Good morning, everyone. Today, we're going to discuss a critical medical condition, the hypertensive crisis. This presentation will cover what a hypertensive crisis is, why it occurs, what immediate actions you should take if you suspect one, and the vital steps for recovery and long-term prevention. Understanding this condition is paramount for protecting your health and that of your loved ones. A hypertensive crisis is not just a very high blood pressure reading. It's a medical emergency defined by a sudden and severe increase in blood pressure to 180/120 millimeters of mercury or higher. This critical elevation signals that your body's vital organs, such as your brain, heart, and kidneys, are under immense and immediate threat. It's a situation that demands rapid recognition and intervention to prevent serious, potentially irreversible damage. It's crucial to distinguish between the two types of hypertensive crisis. A hypertensive urgency means your blood pressure is extremely high, at 180/120 mmHg or greater, but there are no signs of new or worsening organ damage. This is serious and requires prompt medical attention, typically with gradual blood pressure lowering using oral medications in a controlled setting. On the other hand, a hypertensive emergency involves the same extremely high blood pressure, but with clear evidence of new or progressive damage to vital organs. This is a life-threatening situation demanding immediate hospitalization, often in an intensive care unit, and rapid blood pressure reduction, usually with intravenous medications. Symptoms of a hypertensive crisis, especially an emergency, are often indicative of organ distress. These can include a severe headache, blurred or double vision, chest pain or discomfort, and shortness of breath. You might also experience nausea and vomiting, confusion, dizziness, or a change in mental status. Neurological symptoms like numbness, weakness, or tingling, particularly on one side of the body, difficulty speaking, or even seizures, are strong indicators of an emergency. While nosebleeds and anxiety can occur with less severe hypertension, their presence with very high readings should prompt concern. A hypertensive crisis typically doesn't happen without a reason. The most common cause is non-adherence to prescribed blood pressure medications, either forgetting doses, stopping them suddenly, or not taking them as directed. Other factors include interactions with certain over-the-counter or prescription medications, and the use of recreational drugs like cocaine or amphetamines. Underlying medical conditions such as kidney disease, rare endocrine tumors like pheochromocytoma, or pregnancy complications like preeclampsia can also trigger a crisis. While acute stress or very high sodium intake can contribute, they are rarely the sole causes. Ignoring a hypertensive crisis, particularly a hypertensive emergency, is incredibly dangerous. The extreme force of blood against artery walls can overwhelm the body's protective mechanisms, leading to catastrophic organ failure. This can result in various types of stroke, severe cardiac events like heart attacks, acute heart failure, or the life-threatening aortic dissection, a tear in the body's largest artery. It can also cause acute kidney failure, and internal bleeding in other areas, including the eyes, potentially leading to permanent vision loss. These outcomes underscore why immediate medical attention is so critical. If you or someone you know experiences a blood pressure reading of 180/120 mmHg or greater, and is showing any of the symptoms we discussed, like severe headache, chest pain, or vision changes, this is a medical emergency. Call 911 or your local emergency services immediately. Do not attempt to drive yourself to the hospital, and crucially, do not take extra doses of your blood pressure medication unless specifically advised by a medical professional. Every minute counts in these situations to prevent permanent organ damage. If your blood pressure is 180/120 mmHg or higher but you have no symptoms, you may be experiencing a hypertensive urgency. While not as immediately life-threatening, it still requires prompt attention. First, remain calm and sit quietly for at least 5 minutes. Then, recheck your blood pressure, ideally taking 2 readings a couple of minutes apart. Ensure your home monitor is accurate. If the reading remains elevated, contact your healthcare provider immediately or go to an urgent care center or emergency department. Do not wait for symptoms to appear, as organ damage can begin silently. Remember, do not adjust your medications on your own. When paramedics arrive, their immediate focus is assessment and stabilization. They will take multiple blood pressure readings, check your heart rate, breathing, and oxygen levels, and perform a quick neurological assessment. They will establish for access, provide oxygen if necessary, and connect you to a cardiac monitor. Their role is to manage immediate symptoms and prepare you for hospital care. It's important to note that, unless there's a specific, severe condition like an aortic dissection, paramedics typically won't attempt to rapidly lower your blood pressure in the field. Their priority is safe transport to the emergency room while closely monitoring your condition. Upon arrival at the emergency room, doctors will immediately conduct a rapid assessment to check for any organ damage, ordering tests like blood work, an ECG, chest X-ray, and possibly a head CT scan. If a hypertensive emergency with organ damage is confirmed, you'll likely be admitted to an ICU. Here, powerful intravenous medications will be used to carefully and rapidly lower your blood pressure, typically aiming for a 20 to 25% reduction within the first hour or two. Your blood pressure will be continuously monitored. If it's a hypertensive urgency with no organ damage, you'll receive oral medications for a more gradual reduction, be observed for a few hours, and then discharged with instructions for prompt follow-up with your primary care doctor. After medical intervention, diligent follow-up is critical for your recovery and to prevent future crises. Adhere strictly to all medical advice, including medication regimens and follow-up appointments. Do not self-adjust or stop your medications. Regularly monitor your blood pressure at home and keep a detailed log for your doctor. Crucially, adopt a heart-healthy lifestyle. This includes following a low-sodium diet like the DASH diet, engaging in regular physical activity, maintaining a healthy weight, limiting alcohol, quitting smoking, and actively managing stress. Also, work with your doctor to identify and avoid the specific triggers that may have caused your crisis. Post-crisis testing aims to identify and quantify any organ damage. Immediately after a hypertensive emergency, doctors will perform critical assessments. This includes an electrocardiogram, or ECG, to check your heart's electrical activity for signs of a heart attack or strain. Blood tests will assess for heart muscle damage, check for internal bleeding, evaluate kidney and liver function, and electrolyte balance. If you experienced any neurological symptoms, a head CT scan will be crucial to look for bleeding or signs of a stroke. A chest X-ray will also be performed to check your heart size and look for fluid in your lungs, which can indicate heart failure. Depending on your symptoms and the initial findings, further diagnostic tests may be performed. An echocardiogram provides detailed images of your heart structure and pumping function. If an aortic tear or aneurysm is suspected, a CT angiography will be ordered. A urinalysis will check for kidney damage, and a specialized eye exam, called fundoscopy, can visualize blood vessel damage in your eyes, which reflects damage throughout your body. Lastly, if the cause of the severe hypertension isn't immediately clear, your doctor may investigate underlying causes through tests like a urine toxicology screen for recreational drugs, or an endocrine workup to check for rare hormonal conditions that can cause high blood pressure. The best way to avoid a hypertensive crisis is through proactive prevention. If you have been diagnosed with hypertension, consistent medication adherence is paramount. Take all prescribed medications exactly as directed. Regularly monitor your blood pressure at home and keep a log for your doctor. Embrace a comprehensive heart-healthy lifestyle, including a low-sodium diet, regular exercise, maintaining a healthy weight, limiting alcohol, quitting smoking, and practicing stress management techniques. Attend all your regular medical checkups, be vigilant about potential medication interactions, and always avoid illicit drugs, as these can be powerful triggers for a crisis. In conclusion, a hypertensive crisis is a serious and potentially life-altering event that underscores the critical importance of blood pressure control. While immediate medical intervention is crucial to stabilize your condition and prevent catastrophic organ damage, your role in the aftermath is equally vital. By understanding the causes, knowing what to do immediately, strictly following medical advice, diligently managing your blood pressure, adopting a heart-healthy lifestyle, and attending all recommended follow-up appointments, you can significantly reduce your risk of future crises and protect your long-term health. Never underestimate the seriousness of high blood pressure. Your proactive engagement is truly the best defense against its potentially devastating consequences.